Thank you, Dr. Neha Kakar. Good evening, good afternoon, and good morning. This is the 1729th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Upendra Kumar Verma. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again and you can subscribe the same without paying any money. The International Forum for Promoting Homeopathy was formed at the time of COVID to connect between doctors among the world as well as to promote homeopathy among public. We were able to have sessions from 6 doctors and eminent personalities from medical profession to talk on different subjects from more than 65 countries. And we have talked about almost all subjects here. And let me introduce the guest of the day. Once again, it is Professor Dr. Upendra Kumar Verma. Sir has completed DHMS and then took MD in homeopathy and now has an additional degree in German language from Max Muller Bhavan, New Delhi, and Sir has an experience of 33 years in clinical side and a teaching experience of more than 29 years. At present, working as the Vice Principal and Professor and HOD in the postgraduate Department of Organon of Medicine and Principles of Homeopathic Philosophy at GD Memorial Homeopathic Medical College and Hospital, Patna. And Sir is a member and board of study, HP University Shimla, and he's as you all know, all the professors are examiners as well as question paper setters and all those. And Sir has presented different papers from different part of the world, particularly in the Liga conference in New Delhi in 2021, and presented several papers at CCH workshop, and has conducted ROPT ROTP at GDMH Medical College and Hospital at Patna. And Sir's clinical address is Homeo Medicare Market Road, Khanabad, Patna. And today, Dr. Sir is talking about renal calculi and its homeopathic management. Sir has presented different sessions in this forum, and all the presentations were exemplary, brilliant. And today, we proudly welcome Dr. Upendra Kumar Verma, sir. Welcome, sir.
Very good evening, sir. Am I audible?
Yes, everything fine.
Yes, sir. Okay, sir. Thank you. So first of all, I would like to once again thanks for giving me an opportunity to talk the International Forum of Homeopathy. And this is the one of the forum I definitely appreciate and continuous efforts of yourself. It is a great salute to you as well as Dr. M.K. Sani, sir, that you are doing continuously a work related to education and educating the homeopathic faculties through the cases, through the lectures, through the webinar. This is one of the greatest efforts which is being taken by yourself, your good self. So, introduction has been given by Sir Dhanesh Sarji. So I would like to continue my lecture, which is related to renal calculi. And this renal calculi is definitely, I'm sure, that most of the persons, most of the homeopathic physicians must have treated in their clinical practice. and they might have cured several diseases of renal calculi in their life. And they must have come to the conclusion that homeopathic medicines are very effective while treating renal calculi through the homeopathic system of medicine. So let the world know, let the India know, let the all people know that yes, there is treatment for the renal calculi in homeopathic system of medicine. Last time also, I told this thing that we are discussing over the forum where all homeopathic doctors are sitting here and listening. So they are aware. They are aware that yes, homeopathy can cure the renal calculi. But what about the masses where I want to communicate that let them know through this forum? I would definitely request once again to even Dr. Dhanesh Dasi ki you should promote this forum to the public also so that they should come to know that what we are discussing, what are the diseases we are treating, and how they are being benefited through the homeopathic medicines. Today is my topic is renal calculi and its a homeopathic treatment. So let me share my screen first. So, and I think that this screen is visible to all of you.
Yes, sir. It's visible.
Yes, sir.
Everything fine. You
Okay, fine, sir. Fine, sir. Let me continue. So,
can enlarge it, sir.
okay. So, I would focus over the renal calculi and treatment with homeopathy. So, this is my topic of the today. So, I want to uh, speak over the renal calculi. So, first of all, we should know that what is the renal calculi. So, renal calculi is also known as the nephrolithiasis. So this is the medical term which is being used by the medical persons about the renal calculi. So nephrolithiasis is known as the renal calculi. Also urolithiasis, it is also known as the renal calculi. And lastly, most of the persons, most of the patients says that they are suffering from kidney stone disease. So these are the factors, uh, uh, these are the nomenclature of the renal calculi that they nomenclate like nephrolithiasis or urolithiasis or kidney stone. Why I am saying this? That let novice practitioners should know that what are the terminology which is being used by the medical professions related to the renal calculi. That is why I am saying this. Although I understand that most of the physicians are highly educated on this forum, even then I wanted to communicate this. So let me see, let us know that what is the renal calculi. So kidney stone or renal calculi is generally composed of calcium salt. And this calcium salt is basically of calcium oxalate. And further, it may be added by calcium phosphate and uric acid. So renal stone is a deposition of the calcium salt and it may be further formed like oxalate or added by calcium phosphate or uric acid. So this is the character and this is the morphologically or we can say that what is there in the stone, that is the calcium. Why stones are made formed in the kidney? So as we all know that the primary function of the kidney is to filtrate blood and removes the waste product from the blood and form urine. So this is the basic fundamental thing which everybody knows, every medical practitioner knows that what is the function of the kidney. And when there is disturbance in the filtration system, so blood through the kidney, due to some or other reason, it may produce a stone in the kidney. That is the main focus here, that if there is some disturbance, and that disturbance can be so many factors are there. So usually, tiny stones are passed away with stream of the urine without producing any symptoms. So it happens that the tiny stones are passed away without knowing even the patient that it has passed. But later on, if it is larger, then it can produce some complication. It can give some sign and symptom which can identify that, which can diagnose as a renal calculi. So first I would like to let us see that how it is situated. Everybody knows, every medical profession knows that where it is a kidney and where it is a renal vein, renal artery. Even though we know, but since we are going through the renal calculi, so let us see that the system, that kidney is there, two kidney are there, a pair of kidney, and its work is to filtrate the urine and blood, and there is renal artery, renal vein, then inferior vena cava, etc. So there is ureter. So from kidney, ureter are coming and coming to the bladder, and from bladder, the urethra is attached, and where from the urine is passed. So this is the general understanding of urinary system. So urinary system is made of composed of this kidney, ureter, bladder, and urethra. Now let us focus over the general anatomy of kidney. So kidney, I am not discussing in a detail. Why I am not discussing? Because anatomy and physiology has been studied by all the physicians of homeopathic faculty. So just I am giving view, a glance, that how a stone can be formed. So what are the reasons where the stones can be formed? So here we can see in the vertical section of the kidney that there is a renal sinus, then this portion is called cortex, then medullary, pyramid, renal artery, pelvis, renal vein, and in the lower part you can see the major calyx and minor calyx, and then the ureter. So these are the things which can be observed. If a vertical section of kidney is done, then we can find these areas. So generally, the kidney stone may be single or multiple. It may be single or multiple, any side. So it may be one side, right or left, or it may be both sides. So renal calculi is not fixed that it will be right side or left side. It may be either side or both side, and it may be located, as I have shown the vertical section of kidney, that it may be located at calyx or medulla or ureter or at UV junction, that is uretrovesical junction. It may be in urinary bladder also, or it may be first time or recurrent stone formation. So these are the factors for which the patient used to come to us in our clinic to get them treated. So it happens so many times that the patient comes that they are suffering from the recurrent renal calculi. So they have been operated, it is through the lithotripsy or some other measure also, but the stones are keep on formation. Later on, after 2 years, 1 year, the stone is again formed. So this phenomena is continued in their life. So this is the factor where the homeopathy is required. When they suffer 2, 3 times, then somebody suggests that why they should not go to the homeopath. Then they come to us and ask for the treatment or remedy. So here we can give the treatment to such persons of the recurrent stone formation also, and we can seize the recurrency of the stone. So let us see now again a nomenclature of a stone that should also be understood by the physicians. Why I am saying that sometimes it is mentioned in the report. So let us see that what are the nomenclature is being done by the radiologist or the person who do the USG or X-ray. So when a stone is in kidney, it is called a nephrolithiasis. Definitely, nephro means related to kidney. So when a stone there, the kidney is called as nephrolithiasis. But when a stone is in ureter, then it is called ureterolithiasis. Very simple. It is related to ureterolithiasis. When it is in urinary bladder, it is called as the cystolithiasis. So these are the three junction or three location where usually a stone is found. So first is the nephrolithiasis, meaning by the stone is formed in the kidney. Then it is called as the ureterolithiasis, when the stone is formed in the ureter, and when it is in urinary bladder, it is called as cystolithiasis. So these terms, one should understand that these are the terms so that they can know that where a stone is. So renal calculi, you can see, or one can see, and we can see, rather I will say, that it is one of the picture which has been taken from the photographs of the availability at the website or Google, that how the stone looks like, and it is at several junctions. You can see the stones can be single or multiple. So here a multiple stone is shown here. And in this also you can find that kidney, and here are the, it is a stone is here uretero, and it is in calyx. So stones are there just to know the effect, the location of stones. Now, if there is some stone and if the person is suffering, there must be some guiding symptoms of renal calculi, so that the doctor, the physician, should know that yes, such and such person may be suffering from renal calculi. So, what are the indications due to which a physician can understand that yes, such and such person is suffering from the renal calculi? So, first is the severe pain in the lower back, lumbar region. It is the commonest site of the kidney stone trouble or a symptom. It may be right or left according to the situation of the stone, right? So if it is a right-sided stone, then one may face, or one may get trouble, or one may experience the pain in right lumbar region. It may be of backside lumbar region or in the front also, that is in abdominal region also. Pain in abdomen is the common, and sometimes it is complicated with the vomiting. So renal stone with vomiting also. Or sometimes it also happens that a stone is in such a position, such a location, that there is obstructions urine, and then it is a situation where painful urination is felt by the patient. Sometimes such condition is worsened, then the blood in urine, it is found that there is blood also. So such conditions, these are the symptoms particularly related to the renal calculi. So these are the guidelines which make us to know that the patient is suffering from the renal calculi, and such patient are to be advised for ultrasound, sonography, or X-ray, or whatsoever, CT scan, etc. can be done. Can be according to the case, one doctor can suggest. So to confirm whether the patient is suffering with a renal calculi or some flatulence, so just it is one of the confirmatory symptom for which we are getting such test is done. So general investigation is X-ray of KUV. KUV means kidney ureter bladder, or you can say we can write down or advise the patient USG of whole abdomen along with KUV or simply KUV, then CT scan of KUV, kidney ureter bladder. There are further several other diagnostic measures also, or investigations, which can be advised according to the complication of. But the basic thing for any patient, the initial or primary investigation is X-ray of KUV or USG of KUV. If it is not found here, then we can suggest CT scan of the KUV. Okay, so now if such investigation is done and if the patient is diagnosed with a renal calculi, then how the treatment of renal calculi is to be done in homeopathic. So first, we should know that in modern system of medicine, or we can say the allopathy, it is totally surgical case. It may be removed by lithotripsy or ureteroscopic surgery. So if a patient goes to the modern science or surgeon, they suggest these examination related to renal calculi. So if a patient come to treatment for homeopathy, although renal calculi is surgical cases, but several cases can be well managed and treated with homeopathic treatment. Yes, it is true that most of the cases, even in the first hand, if the patient comes to us, they can be treated easily, and stone is passed away in a very natural manner, natural way through the urine and without producing any pain or suffering to the patient. I do not say that there will not be any pain or suffering, but sometimes it happens that if a stone is slightly larger, more than 7 mm, then, and if it is passing through ureter or urethra, then it might hurt the inner wall of the ureter or urethra. So at that time, the patient may feel a lot of pains along with the obstructions of urine, along with the bleeding from the urethra also. But such condition can also be managed in homeopathic very easily with a just within a few hours, it passes the stones. And we are sure at that time that yes, stone is traveling to the path through the urethra where from it will be expelled. So such condition is also very much managed with the homeopathic system of medicine. So renal calculi, a few indicated medicines therapeutically, I would like to suggest that as we our tool is the diagnostic tool is repertory. So we can see that there are the medicines in the synthesis repertory of third grade. Third grade meaning by everybody is knowing that third grade is the most marked indicated medicine, that is acid benzoic, calcarea carb, lithium carb, lycopodium, rera breva, sarsaparilla, etc. So these are the commonest medicine which are being used to treat the renal calculi for the patient. And in this synthesis, second grade medicines are also indicated like antimalcodum, berberis vulgaris, canthris, nitric acid, petroselinum, petroselinum sativum, phosphorus, ruta, sepia, alicia, tabacum, ginkgamate, etc. So these are the further medicines which can be thought of during the treatment of the renal calculi. Now, how can we proceed through this thing? So, if it is a right-sided, it simply indicates, it is not sure that I am not telling, I am not giving, but a guideline can be formed through this study that if generally the treatment is being given, although the homeopathic treatment is based on the holistic treatment, that is after taking the physical general, mental general, and all. But this is what I am saying, that sometimes the indicated medicines can work also and give us indications also. So if it is a right-sided kidney stone, the lycopodium is suggested in the repertory. If it is a left-sided stones, then saxifraga granulata is indicated. And if stones, this is the indications of the right-sided and left-sided. And if there is urine sediments, that is brick red indications, that if there is urine sediment, sand, gravel, it means that dust of stone powder like, then medicines are definitely lycopodium, sarsaparilla, and sepia. Mind it that these medicines can be prescribed, can be given to the patient if other symptoms, related symptoms, are also matching to the case. So if other symptoms are also matching to the case, then the medicines is sure to act and our work will be accomplished. That is, we will be able to remove the renal calculi. So there are several other medicines also, like if there is urine sediment threat. That means, as I told you, that sediments means a lower side deposits some brick dust like. So for such condition, the third grade medicines, and it means that the topmost medicines are indicated. For this is arnica, arsenic album, arundo, digitalis, lycopodium, mercurius cor, pereira breva, phosphorus, selenium, senicula, sepia, tarantula, etc. So these are the medicines which are indicated for the cases where we find that there is some red sediment in the urine of the patient who is suffering from the renal calculi. So a general outline of the few most indicated medicine to the renal calculi and what is written in the books, especially in the SCLN's keynote or William Borick or Kent lecture. But I am going to focus over that. Let us go through. Although I understand that most of us knows very well that what is written in the Borick related to the renal calculi, what is written in the Kent lecture related to the renal calculi, what is written in the Borick for the renal calculi. However, if we are studying renal calculi and homeopathic treatment, then let us see that what are the written and let us revise such things so that in our clinical practice, we should not miss something which is very much essential. So if it is lycopodium in boric, we can find that urine, that is pain in back before urinating, ceases after flow incoming, must strain. So this is the characteristics of lycopodium clavatum, which is written in the body, that there will be the pain in back before urinating. Just before the urination, the patient can feel the pain in the back and ceases after flow. And this pain ceases when the flow is over. So it ceases the flow also, flow and slow in coming. And urine is usually slow and patient has to strain to pass the urine. So this is the one of the indications of lycopodium, which is retained in the body. And there may be the retention, then there may be the polyuria during the night and heavy red sediment. So this is written in the body about the lycopodium. Now let us see that what is written in the Allen's keynote, which is most popular book and it is most practiced and it is most helpful for practicing homeopathy. And here we can find that in lycopodium clavatum, it is written that red sand in urine, and child cries before urinating. That can also be treated with borax also. Pain in back, relieved by urinating, renal colic, right-sided, and for left-sided it is Berberis vulgaris. So here we can find that how nicely it is written in the Allen's keynote that child's diaper. In the child's diaper, we can find some red sand in the urine, and such child cries before the passing urine, and pain in back is relieved by urinating. So, lycopodium, even in the boric, it is said that pain of the back is relieved by urinating. Here also, Allen's keynote is saying same thing, and red sediments is also told by both the writers. And it is right-sided, basically remedy for the right side renal calculi, the lycopodium. And here in this book only, HCLN key note, for left side, Berberis vulgaris is indicated. So one can find, but in the synthesis where I have discussed, that was not showing the Berberis vulgaris, rather other medicines. Now, I have seen the boric and Elensky note. Now I want to see the lycopodium by taking it. What he says during his lecture. He says the kidneys furnish many symptoms and may be key to the lycopodium in many instances. Like there seems to be some inactivity in the bladder, as in rectum, who though he strained ever so much, he must wait long time for the urine to pass. So straining at the urine and waiting to pass the urine is written in the both as well as in the Boric as well as in the Kent lecture. It is slow to flow and flow in a feeble stream. So a stream is also feeble. It is very weak. The patient says that they do not have the force while urinating. It is feeble. We find this state in the febrile conditions also. In acute stage of disease, where the red sand appears copiously, lycopodium is often the indicated remedy. So here it is also confirmed that red sand like if coming, whether it is the boric or Elensky note or even Jeticane, confirm that this is the one of the symptom it can be found for the lycopodium. This is a very prominent symptom. In chronic symptom, when the patient feels stressed, the red sand is found in the urine. It is also one of the things that one should know and understand that sometimes it happens that when the red sand is coming, at that time only the patient is feeling well. So lycopodium has retention of urine and suppression of urine. So it is about the Kent lecture related to the lycopodium. Now let us see the second medicine. Second medicine, that is sarsaparilla officinalis. It is also being prescribed by most of the physicians. And let us see that what Elens says. So severe, almost unbearable pain at the conclusion of the urination. So here in the sarsaparilla, this is one of the characteristic symptoms that there is pain at the conclusion of the urination. Means when they are stopping to urinate, at that time there is pain. And for such condition, one can think of berberis as well as equisetum, medorinum, and thusol. So passes of gravel in a small calculi, renal calculi stone is bladder, that is bloody urine. And in the sarsaparilla, we can find that urine is bright and clear, but irritating, scanty, slimy, flaky, sandy, copious, passes without any sensation. And for that, causticum can also be indicated, deposits white sand. Here we can find that in lycopodium there is red sand, but here in the sarsaparilla, the characteristic is about the white sand. So painful distension and tenderness in the bladder, urine dribbles while sitting. Sometimes it happens that a patient, mostly the patient of the older age, more than after 40 years, some patient may feel that while sitting the urine dribbles, ooze out from the urethra, and the most important and the characteristic symptom for sarsaparilla that the patient cannot pass the urine while sitting. So while standing, he passes the freely, and air passes from the urethra also. Sometimes flatulence air is also passed from the urethra. So this is the characteristic related to the sarsaparilla, which has been written in the SCKLN. Now, what is written in the William Boric, related to the sarsaparilla? Here, urine is scanty, slimy, flaky, sandy, bloody. So it is the same which is written in the Helensky note, gravel, renal calculi, severe pain at the conclusion of urination, urine dribbles while and bladder is distended and tender, child screams before and while passing the urine. There also we find one place also that child screams, where I told about the borax also. So sand on diaper, it is also mentioned in the previous medicines, that is lycopodium. and renal colic dysuria in infant, especially sarsaparilla is indicated. Renal calculi along with the dysuria in infant, and pain from the right kidney to downwards, and tenesmus of bladder, urine passes in thin feeble stream, and pain in the meatus. So these are the characteristics related to sarsaparilla, which has been written in the William Bonney book. Every book is very much important to study because a few symptoms may be not written in Allen's keynote, some symptoms may not be written in the Kent, and some symptoms may not be written in the Boric also. So a physician should go through the writing of the stalwarts of every medicine so that they can understand. Although it cannot be completed that after studying 3 books, your medicines will be completed. No, it is not like that. So in Sarsaparilla, in the Kent lecture, it is written that frequent ineffectual urging to urinate with diminished secretion. And this medicine has many times dissolved as stones in the bladder. It so changes the character of urine that it is no longer possible for the stone to build up, and it grows smaller by the continual dissolving of form the surface. So Dr. Kent has written very good in his lecture that this is the medicine which can dissolve the stones, and it cannot make it to grow further, but rather it diminishes its growth and its size also. So sarsaparilla is a very good medicine as a to dissolve the stone. I have seen here it is written by the Kent. So I have seen the high colored bloody and mucus urine cleared up by the administration of sarsaparilla, but on standing the sand would appear. And when the urine again becomes cloudy, it is time for another dose. So Dr. Kent has suggested that another dose can be given if the urine has become cloudy and the urine holds in the solution that is actually dissolve the substances of the stones. That is why urine has become the cloudy according to Dr. Kent. So it is further written by Dr. Kent that some years ago, he is sharing his experience that some years ago there was an old man upon whom a surgeon was expected to operate. He was not operated at that time, but it was planned. They had sounded his bladder and said that he had a stone, but he came to the conclusion that he would not permit for the operation. So, if he is not permitting, in spite of their warning, he sent for me, and I took the charge of his case and his symptoms, whatever the indicated symptom, that was for the sarsaparilla. That is, that the indicated symptoms, indicated sarsaparilla is to be given. The enormous amount of sand he passed in the next year was wonderful. It mitigated the catarrh and kept the bladder comfortable. At the end of the year, after night, great suffering, he passes a stone the size of a pea. So it was experienced by Dr. Kent. So he is telling about that how the stone was formed. Sarsaparilla is further written by the Kent that he passes several small stones after that and then returned to the health. A young man passed so much crusty deposit that I ordered him to use the commode and let it be settled, pouring of the urine. At the end of the month, there was a layer of 16th of an inch thick. So it was a layer of 16-inch thick, the sand of the gravel of the stone like that. This patient under the sarsaparilla had no stone. The sand continues to pass, but was held in the solution and deposited only on cooling. In this course, in the course of time, it disappeared. He was agouti and the patient was relieved. So this is all about the sarsaparilla, which Kent has written. Now there is, I told you about the three medicines, that is Lycopodium, Sarsaparilla, and Berberis vulgaris. Berberis vulgaris, I told that it is mostly indicated, and in my clinical practice also, I have seen that for the left-sided stone, it works wonderfully. So, Kent writes about the Berberis vulgaris, but the burning, stinging, tearing, stitching, wandering pains are the main features of the grand features of the Berberis. If one can single them out in place in a given joint, from one joint they will radiate in every direction. So Berberis vulgaris is such medicine as we see in the cases of Rustox or Pulsatilla also. So if it is a knee joint, they will go up and down and every way. It is the finger joint, they will run in every direction. If it is a kidney, they will go down the ureters. If it is the liver, they will go down into the abdomen in every direction. Radiating from one particular point is a distinguished featuring. It puts the bacteria almost alone for radiating pains. Feature, and it puts Berberis almost alone for radiating pains. This is such a strong feature of Berberis has cured renal colic in many instances because of its well-known ability to shoot out the every direction. It cures gallstone colic when these little twigs go in every direction from that locality. Now, Berberis vulgaris from Boric. So, urinary burning pains, sensation if some urine remains after urinating. So, it is one of the characteristic symptoms of Berberis vulgaris that the patient feels that some urine is still remaining in the bladder. Urine with thick mucus and bright red chili sediments. Bubbling sore sensation in the kidney. Pain in bladder region. Pain in the thigh and loins on urinating. Frequent urination, urethra burns when not urinating. So pain is when the patient is not urinating, there is lot of pain and this pain is wandering. And according to Allen's keynote in the Berberis vulgaris, it is written there, the renal or vesical symptoms predominates. Pain in a small bag, very sensitive to touch in the renal region, worse when sitting and lying, worse from jar, and worse from fatigue. Numbness and stiffness, lameness, and painful pressure in the renal and lumbar region. Renal colic worse left side. Here it is written that renal colic is worse in the left side and tabacum either side with urging and strangury and canthris. So canthris is also indicated. Sometimes it is also said by some of the stalwarts that when there is a stone in the bladder or urethra and it is on the verge of passing, and when there is a lot of pain and burning, then here canthris is to be given frequent doses that can remove the stone. So bubbling sensation in the kidney, that is medorinum, can also be given. Urine greenish, blood red with thick slimy mucus, transparent, ready or jelly-like sediments, movements, rings or an increase of urinary complaint. So when movement is there, it may increase the pain. Now, one in medicine is there, the Parivira Paraiba. The urinary symptoms are most important, useful in renal calculi, prostatic affection, and catarrh of the bladder. And sensation as if bladder were distended with pain going down the thigh. And heteroselinum, the urinary symptom is written as the burning, tingling from the perineum throughout the whole urethra, sudden urging to urinate, frequent voluptuous tickling fossa navicularis. So similarly, now I would like to focus over cases. So first case, I am just telling about that this case is in the memory, and it was a very good and wonderful case of one of the case of mine. Why I'm saying that I did not give any indicated medicine as explained by me, like Lycopodium, Sarsaparilla, Berberis vulgaris, Pereira brevia, Petroselinum, but I gave some other medicines according to the sign and symptom presented by the patient. So a lady of 28 years came with pain in the right lumbar region, and I thought that this was a renal pain. So I advised X-ray. So there was 8 mm stones in the right kidney. So on the basis of the characteristics of pain and modality, as she was telling that there was pain and pain was better by pressure, she was slightly uh, swarthy in color, and having a very black hair. Her constitution was indicating towards the brania. Her thirst was increased. She was taking lot of water at a time. There was dryness in the mouth. So on the basis of these characteristics, without including the stone symptoms, I gave Brenia 200 twice daily, and she recovered. She passed the stone and she recovered. And she sent me a number of patients. Although this is the case of our college, that is GD Memorial Homeopathic Medical College. So at that time, I thought that I should not give several medicines. So I focused over the only one medicine, one dose. So Brania 200 was one dose was given, and it cured the whole case of the renal calculi. So this was the wonderful experience by me by the case. Next case, it is also in my memory. Sometimes it happens that we do not keep the records, and it happens that most of the patients do not want to uh, follow the advices by us. They usually in homeopathy, when they come to us, they came with the reports which was advised by the allopathic physicians or surgeons. Then they show us, and on the basis of that report, we prescribe. And whenever we advise another reports for another investigation of X-ray or USG, then at that time also they mistake that they take the previous prescription, and the radiologist do that also. So usually our name is not printed on the report. It also happens. So one of the case in the memory, that a male patient is about 35 years working in the railway department. He was very close to me as his wife was also being treated, so he became very close to me. And previously also I treated him for lumbar disc displacement, and that was cured when the doctor had advised that he need to undergo for surgery, but that was recovered with the homeopathic medicine from our clinic. So he has lots of faith in me. So he came for the treatment of this time with a 7 mm renal stone, and came the clinic after in the year 2013 with X-ray. There was a stone of 7 mm perhaps in the right kidney, with the words from him, allopath, that allopath surgeon says that it will not go through the any type of medicine, whether it is homeopathic or Ayurvedic. You need to go for under surgery. Then he came to me, and when I gave the medicines, so there was no improvement for within 3 or 5 days. Then he again came to me, and he said that, what are you treating, doctor? So I am not getting relief at all. So when it will come out, when it will pass out? I said, it takes time. Then he told me that you tell me that when it will come out. Usually what happens? He was telling like that if there is pregnancy, the doctor says that after 9 months, the birth will be there. So you say that if there is a stone, then when it will pass out. Wife was just smiling and listening to him. But he said that I am not sleeping well at all at night. So what he does, he sat squatting position in our clinic and told me that this I am sitting, then only I get the relief. So it was one of the indications. And then I gave him Holocene 200, and 1 dose, and within 3-4 doses, a stone was removed. And after removing of the stone, 3-4-5 days, it means total 1 week, he got X-ray done and went to the surgeon and told that, see, this is the how the stone has been finished with the homeopathic treatment. So this was very wonderful case. So these two cases definitely teaches us that we need to see the characteristics of the symptom, and we need to see the characteristic and individualistic feature of the patient also. So likewise that I have cured several patients with the other medicines. There are several medicines indicated for the stone, and there are several cases also which I wanted to show you that this is one of the case of Rakesh Kumar. It was treated in 21, and after totality, his lycopodium and berberis lycopodium, one name dose given, and berberis vulgaris regular, and placebo was given, and the patient was report. I don't know whether you are seeing or not. So in this
Yes, sir.
report, it
Yes,
is
sir.
there. I
We
don't
can
know
be,
whether it is visible or not.
yeah, it is visible, sir. It's visible.
Okay, then fine. Then here one can see that here slightly enlarged spleen and the renal stone has been removed. And this is the another case of Deepa Gupta. She was also suffering from the renal calculi, and after treatment, she was advised USG at 29/1/2020. And when and she was given the treatment Barbaris vulgaris and lycopodium. And at that time, again, she was advised, and there was no stone at all. Only fatty liver grade 1 was observed. So this is how we are treating the renal calculi. So for renal calculi, homeopathic treatment and observation, there is great scope of the treatment of renal calculi in homeopathic system of medicine. If the stone is below 10 mm, it is sure that we will remove sooner or later. But it is up to 8 mm, we should be sure that it will be removed within 1 or 2 months. First, we should try to treat with the totality of the symptoms. If we do not find guiding symptom and characteristic symptoms, if the symptoms are deficient, we can treat them with therapeutically indicated medicine, that is Berberis, Sarsaparilla, Lycopodium, etc. But most of the patients do not report after the treatment, which results in recurrent stone, since the patient was not treated at last with the anti-miasmatic and constitutional symptom. The metabolism has not been dynamically corrected, hence the possibility of recurrence is there. Usually what happens, so now I have made it practice that whenever the patient come for the treatment of the renal calculi, I advise him, please do not forget to take the medicine after the removal of the stone, because at that time we will give some medicines which will be protect you from the recurrence of the stone, and such treatment is very much essential for every patient who is suffering from the renal calculi. So this is being advised to the every patient. Hence, we should advise in advance that even renal calculi is removed, patient should get further treatment for 1 or 2 months so that recurrence should be ceased. So this is what I wanted to convey about the renal calculi and homeopathic treatment. I hope that you must have understood that what was my idea related to renal calculi. Over to Dr. Dhanesh.
Thank you. Thank you, Professor Dr. UK Verma, sir. It's really a very good session. And you have come across with almost all remedies when one talk about in a pathological way or pathological prescriptions way. But as you rightly point out in the last, you need to go with the correct treatment by using the constitutional medicine. That's the reason why you got the result in this bryonia for the first case. And yes, that is what we have noted here. But there are cases where we get sometimes more than 10 millimeter size or 1.5 centimeter size stones. Here we can use our stone breaker or breaker medicine like that. Silesia sixes can do wonders in breaking the stone. And
Oh, very good. Wonderful.
and after breaking, you have to remove it through the ureter. For that also we have medicine. Ammi Visnega tincture will do the work of dilating the renal tubules, and thereby
Okay.
but the most important point is that you will have to continue with the constitution medicine uh, along with that treatment. In those advanced pathological conditions like that, we can also use these remedies in tandem. Otherwise, you may not, you have to revert them for surgical purpose. And this is what, anyway, really, you come across with all how it forms and what are the reasons and what are the things to be done. Of course, people believe that it is not no, it is because of this lack of taking water, but actually it is not. We have a case here where the patient used to take for 3 to 4 liters of water, but still he is getting stoned regularly. In those cases, we can definitely say that there is some mental factor behind the illness. That am I
Yes.
right, sir?
Yeah, you are absolutely right, sir.
Yes, yes. Of course, you need to take water, but and too much of water will sometimes do damage if the kidneys.
Yes, yes, yes. Definitely.
But patient has such a belief that you have to take lot of water. But
Hmm.
as a physician, we need to look into all those aspects also. Anyway, it is only just 1 minute remaining. That's why there is no time for discussion. Uh, if anyone want to talk to you, to Verma sir, you please raise your hand. Otherwise,
Who wants to talk to me?
yes. Rambaresh sir, yes, yes, please unmute yourself, sir. Yes, please unmute. Hmm.
Thank you, Dr. Dhanesh ji, and congratulations. A very, very thanks, Dr. UK Verma sir,
Yes, sir.
for your insightful presentation and renal calculi at IFPH and grateful for you. Very, very thanks. Behalf
Okay.
of IFPH whole team. Very, very thanks. Thank you, sir.
Okay, thank you, sir. Thank you very much, sir.
Thank you, Rambaresh sir, and thank you, Dr. UK Verma sir, and
Yes, sir.
those who attend the session. Hope we can have some more presentation in the coming months as per your convenience, sir.
Okay, sir. Yeah, I will definitely be
Uh,
there.
yeah, we can come up with some more cases, so that everybody can understand how the patient is being treated in homeopathy.
Yes, sir. Sure, sir.
Tomorrow we will be uploading the video of the same, so that you
Okay.
can share it with your students as well as other homeopathy group also, so that more and more people, the session will go to more and more people.
Okay, sir. Thank you, sir. Thank you so
Thank,
much.
thank you very much, sir.
Thank you,
You.
sir.
Tomorrow we will have a session from Dr. Rashmi Shukla, and subject will be suggested by tomorrow morning. Thank you all. Good night.
Okay, sir. Night.
It's over to Dr. P. Shaila to moderate the Malayalam session.